Thank you everyone for coming out. Well, that didn't last long. Thank you everyone for coming out. I know it's really, really cold, so I really appreciate everybody coming out in this. We're also live streaming it on Facebook for those that could not make it. Again, I greatly appreciate everybody coming out. I'm State Representative Mike McFall, House District 14, which you're in right now, which includes Madison Heights, Hazel Park, part of Warren, and Center Line. Most of my work has revolved around legislation having to do with mental health, because our mental health care system needs a lot of fixing, as everyone is fully aware. And so I've been mainly focused on that. But I would like to also make sure that we introduce Senator Stephanie Chang, if she would like to say a few words.
Well, thank you so much, and great to see you all here. Thanks for braving the cold weather to make it here for a really, really important conversation. My name is Stephanie Chang. I'm the state senator for the current Senate District 3, and I think this is just a really important conversation. I think that more now than ever, people across our state and our country are really having to deal with so much of the inadequacies of our healthcare system. And so it's time that we have a serious conversation about reforms. And so I'm just really excited that you all are here to be part of this conversation. Back when I was in the House, I'm pretty sure I co-sponsored a earlier iteration of this legislation. It probably has gone through lots of changes since then, but I think that we're in this building right now where more and more people are recognizing we need like big, bold change when it comes to healthcare. And so I'm looking forward to learning more and hearing everyone's thoughts.
Thank you. And so, as we know, there's been a lot going on at the federal level, or not going on at the federal level. The things that we need to happen don't seem to be happening. Along, like with the ACA credits and those types of things, so that people can actually afford healthcare. I'm not going to spend a lot of time talking because I want to make sure that Representative Rheingans, whose legislation we're going to be discussing, and we will have a Q&A at the end after she goes through some of the explanation of what the legislation does. And so without that, or without any of you, or however that's phrased, it's your turn. As you can see, I always do this. I'm really good at this. So, Representative Carrie Rheingans.
Thanks, Rep McFall. It's without further ado. I am State Representative Carrie Rheingans. I represent the 47th House District in Michigan, which is the western part of the city of Ann Arbor. Western part of the city of Ann Arbor and parts of western Washtenaw County and southeast Jackson County. So I came far to be here tonight with you, but my car has heat, thankfully, so it was not bad. If you see me looking at my phone, I have staff online watching the live stream, and they are going to be sending me questions from folks online. So we know that there's going to be a few people watching online. So I'm not trying to be a jerk. I'm trying to hear the questions of folks online without watching the stream myself and having like that weird echo thing where you have the same thing streaming in the room. So I want to talk about my care. The first thing I'll talk about is my background a little bit, so you know like why the heck do I care about this. Talk about the bill. There are handouts in the back of the room, and there's a brochure in the back of the room, and we can put a link to it into the live stream online for folks to look at online. I'll go through this, and then the majority of our time tonight will be for you and you two to ask questions about the bill. There was one time I did one of these town halls in Lansing, and there was 4 other state reps with me, and it basically turned into a committee hearing. So I say, bring it on. I love answering questions, and sometimes it helps us make the bill better. This bill that we introduced this term is better than last term because of town halls we did last term. So why the heck do I care about this, and how am I justified in doing town halls as a politician, right? About something so major as completely overhauling the way we pay for healthcare in Michigan. About 20 years ago, baby Carrie wanted to work in the field of HIV and AIDS, And at that time, I did a lot of client-based services, syringe exchange programs, HIV testing and counseling. But I noticed that a lot of our clients had multiple issues in their lives, especially social issues, that could be addressed through policy changes. So I started doing a lot of policy advocacy in the world of health and health equity about 20 years ago, and continued that for about a decade. When I went to grad school for public health and social work, I thought I was going to go abroad and do global health work. But while I was there, the Affordable Care Act passed. The semester I was taking my health policy required course. So the professor came in and said, complained that he had to throw out all of his slides, which was a funny joke, but actually he did have to, because his class had been teaching how health insurance policy worked up until the Affordable Care Act passed. So when I graduated from grad school, I worked at an organization called the Center for Health and Research Transformation, CHRT, or CHART, where we do a lot of policy analytics and helped roll out the ACA in Michigan, basically. So I worked there, and I was a policy expert on town halls like this, or panels with our Congresswoman in Washtenaw County, Debbie Dinkle, trying to explain to the community what the heck is in the Affordable Care Act, what is an advanced printing tax credit, all of these things. So that was my job for a couple years. After that, I worked at the Michigan Department of Health and Human Services in the Medicaid policy area, focused on substance use disorder policy, and I started there in February of 2020. So 3 weeks later, after I started, I had to really upend my job and help change our state's policy for telehealth for substance use disorder treatment and recovery services. And then I ran for office in 2022. So I've been a state rep since January of 2023. One of the reasons I ran for office is to introduce this bill, MyCare. I introduced it last term. We heard from folks all across the state, made some changes this term, and reintroduced it. So our plan is to keep making it better till we make it actually the law of the state. MyCare is the name that was given to this bill a couple terms ago when State Representative from Ann Arbor, Yusuf Rob, he introduced this when he was in the state legislature. So that's when he would have co-sponsored it, Senator Chang. And before that, in the 90s, another Ann Arbor representative, Perry Bullard, actually introduced Michicare in the state legislature. And you may all be aware that at the federal level, Medicare for All has been introduced for decades by the Dinkle family. And is now being promoted by Senator Sanders from Vermont, and has been picked up at the federal level by Representative Camilla Jayapal in Washington, though Debbie Dinkle is still strongly involved. So I come by it honestly being interested in completely reforming the way we pay for our health care in the United States and here in Michigan. So let's go through this little brochure to learn more about what the heck is MyCare. And inside, in the top left, you'll see that House Bill 4407 was introduced earlier this year to create a universal, publicly funded healthcare payment system for all 10 million Michiganders. This would cover all medically necessary care without premiums, without copays, and without deductibles. We don't think that you should have to pay at the point of getting care when you're sick, especially. So that's one of the bases of MyCare as a program. This is a way of changing how we finance and pay for healthcare. This is not changing the entire healthcare delivery system. So in the United States, unfortunately, in my opinion, the way you get your care highly depends on how it's paid for. Payment drives delivery of care in the United States of America. And that's because healthcare is an industry, profit-driven industry at that. So that's why how the money moves is what determines how you get your care. I think that's wrong. I don't think we should be profiting off a basic service that we all need to live. So in the middle, what does MyCare cover? This is a non-comprehensive list. This is a lot of the stuff, but it's not every single thing that MyCare would cover. You'll see that in this bill, it's pretty evident that we believe that your brain, your eyes, your ears, and your teeth are all part of your body. And therefore, we should pay for their healthcare services as part of your body. So all of those types of services are covered here. And at one of our recent town halls, somebody asked about specialty care. That should be covered too if it's medically necessary. You see reproductive health care here, and of course behavioral health care is where your brain comes in. How are we going to pay? So right under that list of things that are covered is a description of the payment for services we would like to tie to Medicare negotiated rates. So Medicare, as you all know, is the national health insurance for people 65 and up, for the most part. It covers some others, but it is such a large payer that they already do this negotiation. So we as a state can just tie our rates to what they negotiate, so we don't have to waste all that administrative time negotiating rates. So if some proportion of payment is good enough for people 65 and up, then 1.5 times that is pretty good for Michiganders. For the same reason, we tie medical devices and prescription drug payment to VA negotiated rates. We did have a gap pointed out to us at another one of our town halls. For example, the VA does not negotiate medical or medicine prices for like kids, right? So we do need to figure out how to solve that gap as well. And so maybe in the next iteration of this bill, we'll tie that payment to something else. But this is why I'm doing these, because I need y'all's smart brains. So another principle that I personally have is that, I'm not your medical doctor. I'm not even a medical doctor. I'm a public health and policy expert and a social work macro person, right? Like I do policy and organizing. So I should not be the one deciding what care you get, because I'm not your doctor. I think your doctor should decide that. And I think that the governance of this, it'll be a very large part of our state budget, should be depoliticized. And it shouldn't be politicians who are the ones that oversee the minutia of how this program is implemented. So the board, if you download the bill, it's like 32, 34 pages. Most of the pages of the bill describe who is on the board, what experience do they need, what expertise, how many people, how do they get appointed, and that's really important because they're the ones that are going to be responsible for overseeing exactly which services in that list of covered services. They're going to oversee processes, enrollment, all of those things. So the board is very important. We propose that it be an odd number, 13, and that the members of the board be appointed by the governor from a list that is provided by the House of Representatives. The House of Representatives will have the majority and minority party each provide 13 names, and the governor can select from that list no more than 7 from either party's proposed list, unless both parties agree to appoint the same person. And then we do want advice and consent from the Senate. We haven't done a ton of advice and consent processes in the state Senate while I've been elected for the last 3 years, but I really highly want these positions to have advice and consent. No rubber stamps. I will say that till I'm blue in the face. So these folks on the board will be overseeing probably thousands of employees to implement My Care in the state of Michigan. They will be full-time, they will be employed in the, currently it's listed as Department of Health and Human Services, unless we want to create a whole new department or something, but that's up to the governor who decides to implement this. Experience and expertise, we want health economists, we want some providers, and we want some people with patient experience on this board as well. On the right side, how My Care will work, this is the most complicated part. My bill, House Bill 4407, is a policy bill. It lays out how the program will be working in a very general, broad sense. This is not a financing bill. The financing bill or bills will have to be separate. And so we have been trying to cobble together the way that we think we can fund this, and the major funding source, we do need to use every federal dollar that comes into Michigan. We need to be able to use that into the My Care Trust Fund. So this policy bill establishes the trust fund, basically a big bucket of money, and every federal dollar that comes into Michigan already for Medicare, for Medicaid, for children's special health care services, for Obamacare subsidies, all of that. We want all of those federal dollars to go in the MyCare Trust Fund. And then we want to add some state funding sources, some of which are listed here, like some payroll tax and capital gains. So payroll tax, and we would be interested in a business tax. You may be aware, in the Michigan Constitution, we are prohibited from doing graduated taxation. So in Michigan, we are only allowed to do flat taxing for business and income. And so that is in our Article 9, Section 7, especially the income tax, we're not allowed to do graduation. So for state-based revenue, I think larger businesses should pay a larger tax, smaller businesses should pay a smaller tax. Richer individuals should pay a larger income tax, not as rich individuals should pay less income tax into the MyCare Fund. So we do need a constitutional amendment, because this sucker is out of date in my opinion. So those are some of the major things I think that I'll cover before you start asking questions, because the most important part is the questions. So I will check my phone and just see if there's anything that we've gotten online so far. So folks online, please do actually write your questions in there. But we have 2 mics, so if you have a question, please raise your hand, and Mike will be the micer.